Assalamu alaikum. Let's talk on a very important topic called hypermobility syndrome. If we think about hypermobility syndrome, the two diagnoses comes in our mind. One is Marfan, another is Ehlers-Danlos syndrome. In Marfan and Ehlers-Danlos syndrome, before jumping into the these two topics, let's first diagnose how we can diagnose a case with hypermobility syndrome. In hypermobility syndrome, there are five questions you need to ask or five clinical tests you need to do. One is extend little finger more than 90 degree, 1 point on each side. So first is extend pinkies, little finger more than 90 degree, 1 point for each side. Then thumb to the bring thumb back parallel to or touching forearm. So bring thumb parallel to or touching forearm, 1 point for each side. And the third is elbow extension. Extend elbow more than 10 degree, 1 point for each side. Extend knee more than 10 degree, 1 point for each side. Extend elbow more than 10 degree. Extend knee more than 10 degree. Touch the floor with flat of the hands and legs straight, 1 point. So 4.4 into 2 is 8 and 1 point for touch the floor with flat of hand and leg straight. So hypermobile, a score of 6 or more points out of a possible 9 for epidemiological studies and 4 or more points with arthalgia. So 4 or more point with arthalgia in 4 or more joints for a clinical diagnosis of the benign joint hypermobility syndrome. So that's how we can diagnose a case with hypermobility. Look at this thing. First is extend the pinky, extend the little finger more than 90 degree and bring thumb back parallel to or bring thumb back parallel to the forearm. This is this case 1 point and extend the elbow more than 10 degree. Extend the elbow more than 10 degree. It gets 1 point. Extend knee more than 10 degree. It also get 1 point. And and the final one is whilst can you bend forward and place the palms of your hands flat on the floor in front of your feet without bending the knees. If he can do it, then it is positive and it gets 1 point. So this is modified Bayesian scoring system. So this scoring, with the help of this scoring system, we can diagnose a case with hypermobility syndrome. So when hypermobility syndrome comes in our mind, then the two diagnoses we need to think about. classic Ehlers-Danlos and Marfan syndrome. In classic Ehlers-Danlos, we know that Ehlers-Danlos is an AD, autosomal dominant connective tissue disorder. It mostly affects type 3 collagen. So this results in tissues being more elastic than the normal, leading to joint hypermobility and increased elasticity of the skin. So if we look at the features, if we look at the skin, in skin there is transparent and hyperextensible. There is easy bruising, pore healing. There is easy bruising, pore healing. This two thing is very important. Mm, in skin finding, it is transparent and hyperextensible. Skin is transparent and hyperextensible, and there is easy bruising, pore healing. There is velvety with atrophy and scarring. There is velvety with atrophy and scarring. In the Marfan, there is no such feature, no feature other than the stria. On musculoskeletal system, if you look at the musculoskeletal finding, there may be joint hypermobility in both Marfan and Ehlers-Danlos. There is pectus excavatum in classic Ehlers-Danlos, but in Marfan it may be excavatum or carinatum. There may be scoliosis in both cases, but in musculoskeletal there is high arch palate, very, very, very classical. In Ehlers-Danlos syndrome, there is high arch palate. There is high arch palate. In Marfan, there is tall with long extremity. In classic Ehlers-Danlos, there is MVP, mitral valve prolapse, and Marfan syndrome, there is a aortic root dilatation, or there may be mitral valve prolapse. And the other feature in classic LRGL, there will be hernia, abdominal or inguinal hernia. There may be uterine prolapse, and in a Marfan there is lens dislocation, lens Marfan outward and upward and outward lens dislocation. There is spontaneous pneumothorax and Marfan problem in the FBN fibrillin 1 mutation. It is autosomal dominant, and classic LR it is called 5A1, called 5A2. It is also autosomal dominant. In classic Ehlers-Danlos syndrome, there is easy bruising, poor healing, and sometimes there may be uh, subarachnoid hemorrhage. There may be subarachnoid he hemorrhages. There may be subarachnoid hemorrhages. And in Marfan syndrome, look at the Marfan habitus, arm to height ratio. So arm to height ratio. In Marfanoid habitus, uh, there is lens dislocation. If we look from upward, there is lens dislocation upward and outward. Arm to height ratio, increase arm to height ratio more than 1.5. There is breastbone dips inward and protrudes outward. There may be joint hypermobility, decrease upper body, decrease upper body or lower body segment ratio, decrease upper body and lower body segment ratio. And there may be tall, slender build. There may be arachnoidodactyly. There may be flat feet. Arachnoidodactyly, there may be flat feet. So in Marfan, FBN, high arch palate. In Marfan, we may get the high arch palate. There may be arachnoidodactyly. There may be pectus excavatum, pes planus. There may be scoliosis, and sometimes there may be aortic dissection, and in Marfan, on chest radiograph, there may be hyperinflation, bullous changes, and dilated torsus aorta and tall lungs. Look at this picture. This is chest. In this chest radiograph, there is in Marfan syndrome there is hyperinflation, bullous changes, dilated torsus aorta, and tall lungs. In the lung, there is recurrent pneumothorax, and lens dislocation is upward and outward. Upward lens dislocation. There may be blue sclera. If we look at this CT of the pelvis, demonstrate normal spinal canal. On the right, there is normal spinal canal, and on the B, there is features of lumbosacral dural ectasia, abnormal dilatation. Note the dilatation of the spinal canal. There is dilatation of the spinal canal. This may be associated with pain and headache. The life expectancy is around 40 to 50 years with that one. Regular echocardiography monitoring and beta blocker and ACE inhibitor. This has improved significantly over recent years. And aortic dissection and other cardiovascular problems remain the leading cause of the death of this type of patient. Okay, this is a picture of the pectus excavatum. This is arm span to height ratio. This is the subarachnoid hemorrhage can happen in Ehlers-Danlos. This is skin is very fragile in Ehlers-Danlos syndrome. So that is all about hypermobility syndrome regarding um, classic Ehlers-Danlos and Marfan. Hope you enjoyed.